This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 22 in a 58-part video series of the entire book. I recommend that you view the introduction video on our channel. Part 22 is under Chapter 5, Enzymes and Supplements, and under the subchapter Selenium. Selenium is considered value 2 important. Recommended dosage is 200 micrograms per day minimum to 400 micrograms per day maximum. Persons with heart failure often experience unstable heartbeat rhythm, also known as arrhythmia or cardiac arrhythmia. It is important to stabilize your rhythm as normal as possible to prevent occurrences of blood clots, strokes, and death, sudden death. Selenium is a key nutrient tested in many clinical trials to stabilize heartbeats. The rhythm is critical because 51% of all sudden death events in heart failure settings are caused during an arrhythmia. Selenium greatly reduces this frequency. A clinical study conducted in 1998 with animals discovered selenium reduced the occurrence rate 91%. The animals with selenium had a rate of 36%, whereas tests conducted for ventricular fibrillation showed a rate of 91% versus 45% among those treated with selenium. Selenium is deficient in the soil along the coastal plain of Georgia, and this area has a very high rate of cardiovascular disease among the population. In other parts of the world, there's a disease called Keshan disease, which is a rare deficiency found in Asia and Africa where the soil is deficient in selenium. Scientists have documented heart failure, arrhythmias, enlarged heart, and shock from selenium deficiencies in those areas. Now, selenium is a micronutrient. You should not take excess at any time. It is poisonous in high doses, but supplements, that is capsules, are in millionths of a gram, which is the recommended dosage. Now, the minimum RDA is 55 micrograms, but most capsules are 200, and that's what I take. If you have a serious problem with arrhythmias, you could take one in the morning and one at night for a total of 400 micrograms. Some foods do have selenium, and one in particular can cause an overdose, and that is Brazil nuts. In fact, a 1 ounce serving, or 6 to 8 individual nuts, is 544 micrograms of selenium. Some yellowfin tuna has 95 micrograms per 3 ounce serving. And 200 micrograms of selenium also reduces HDL cholesterol in test subjects. So keep it balanced and just take 1 or 2, no more than the recommended amount. This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available at Amazon in print and Kindle editions, from the Apple iTunes Store in the iBooks edition, from eBay in a print edition, and from Wilkerson and Hughes, the publisher, P.O. Box 777, Altoona, Florida 32702. Just send a check for $24, which includes shipping and handling. Thank you for listening.